Okay, so picture this. You're just about to start making dinner.
Okay.
And like me, you always like to double check the FDA website just to see if there's any food recalls going on,
Uh-huh.
just to be safe.
Right.
But then you get there and the website is completely blank.
Oh, wow.
There are no updates.
Yeah.
There are no warnings.
Huh.
There's nothing.
Yeah.
And that's the reality that we are facing right now.
Really?
It is a total communications blackout across all of the major U.S. health agencies.
Oh, my gosh.
So we're talking the Centers for Disease Control and Prevention,
Right.
the Food and Drug Administration,
Yeah.
the Department of Health and Human Services,
Yeah.
and even the National Institutes of Health.
Wow.
They've all gone silent.
Yeah. That's a little unsettling.
I know, it's a little freaky, right?
Yeah, it is because, I mean, these agencies are like our main lifeline to public health information.
Right.
Everything from tracking disease outbreaks to making sure that our food is safe.
Yes.
They publish all these reports. They issue safety advisories. And they give a ton of essential data to researchers and healthcare professionals all over the country.
Yeah, and it's not even just the websites.
Oh.
It's a complete and total halt
Well,
to all external communications reports, data releases, even those routine emails that we get about food recalls.
gosh.
It's a pretty drastic move, don't you think?
I mean, it is a drastic move.
Yeah.
I will say that sometimes when a new administration comes in, they'll kind of pause communications briefly
Right.
just to kind of review procedures and stuff like that.
Right.
But usually those only last a week or two at most.
Yeah.
The fact that this is going so far beyond that is definitely concerning a lot of people.
Yeah, especially because, President Trump has been very critical
Yes.
to these agencies.
Yes, very much so.
In his inaugural address,
Right.
he even called out the agency's handling of the COVID-19 pandemic.
Right.
He suggested that they really weren't effective in communicating risks and guidance to the public.
And now we have Robert F. Kennedy Jr., who's been appointed to head the Department of Health and Human Services.
Right.
And he has basically pledged to overhaul all of these agencies.
Wow.
He's been very critical of them, especially when it comes to vaccine safety. And a lot of experts are seeing this blackout as a potential first step in his plan to kind of reshape these agencies.
It's interesting, too, because the order for this blackout
Right.
came directly from Stephanie Speer, who is a deputy chief of staff at HHS.
Oh, wow.
But she also happened to be RFK Jr.'s press secretary during his campaign.
Interesting.
That definitely raises some eyebrows, doesn't it?
Yeah, it does. I mean, it does make you kind of wonder what exactly is going on here.
Yeah, so what does this actually mean for us?
Right.
In practical terms, what are we missing out on?
Well, I mean, for one thing, we're talking about the CDC's Morbidity and Mortality Weekly Report, the MMWR.
Yeah.
This report provides really crucial data on trends and outbreaks of diseases. Healthcare workers all across the country use these reports to inform their practices and, figure out how to respond to public health threats.
Yeah.
Those have been paused too.
Oh, wow.
So we're not getting that information.
We're not getting those advisories that go out to doctors and hospitals. We're not getting website updates.
No.
And even things like the data on drug overdose rates, it's just gone dark.
It's just all silent. And the thing that's really concerning to me is the fact that there's no clarity around what they consider an urgent communication.
Oh, yeah.
Would a new drug approval be considered urgent enough to break the blackout?
Right.
What about a new disease outbreak?
Oh, gosh.
These are questions that really need to be answered to make sure that the public is safe.
Yeah. I saw that some experts are even talking about shadow governments.
Yes.
That sounds very scary.
It's a little bit frightening, I think.
Yeah.
Essentially, it's this idea that if the official channels stay silent, then independent organizations might need to step up and start gathering and reporting data themselves.
Wow.
Which is a little bit alarming.
Yeah.
That's kind of a scary thought to me.
It is because, these agencies handle a massive amount of information.
They do. It's a huge amount.
The CDC alone publishes 50 peer-reviewed articles a week.
I know.
And the FDA oversees something like 500 food recalls a year.
Yeah, and billions of dollars
Billions.
in public funding goes through these agencies to support research and public health initiatives.
It's a fire hose of information
It is.
that we really rely
That's
on,
a lot.
to make decisions about our health and well-being.
Yeah, and it's all just shut off.
So, this isn't totally unprecedented, though, right?
Yeah, you're right.
Back in 2017, at the very beginning of President Trump's first term, there was a similar communications pause.
Right.
But it seemed more focused on environmental agencies.
Yes, like the EPA.
Yeah. So is this a pattern?
It's a good question, and it kind of brings us to the biggest question of all.
Okay.
What can we do about it?
Right.
You know, if these official channels stay silent,
Yeah.
where else can we get this information?
What are our options?
Well, it kind of emphasizes how important it is to be media literate and really think critically about what we're reading.
Yeah.
We need to be really careful about the sources that we're trusting.
Absolutely.
And we need to look for organizations that really prioritize evidence-based information and transparency.
Yeah. So for all of you listening out there,
Yeah,
we want to hear from you.
we do.
How do you feel about this whole communications blackout?
Right.
What steps are you taking to stay informed about
Yeah.
public health when you can't rely on these official channels?
Absolutely.
It's a conversation that I think we all really need to be having.
We do.
This is really important.
Yes. This situation is really highlighting how important it is to stay engaged and informed. Absolutely.
Public health affects all of us,
Absolutely.
and we all have a role to play in making sure that we're getting accurate information
Yeah.
and advocating for policies that protect our health and well-being.
Couldn't have said it better myself.
Well, thanks.
Thank you so much for joining us today.
It was my pleasure.
And we'll see all of you next time for another deep dive.